Good evening, everybody. My name is Caden Tyson, and I'm doing my speech number 3 on healthcare affordability. I want you to imagine being in pain, knowing you need medical help, but staying home because you're afraid of the bill. For millions of America, this isn't just a fear, it's a reality. Medical bills are now leading the cause for personal bankruptcy in the United States. And this isn't just about the uninsured. Even people with jobs and insurance are even skipping appointments, delaying medications, and avoiding hospitals because of the cost. I first became interested in this issue during my internship at a physical therapy clinic. I saw patients canceling sessions they clearly needed, not because they were getting better, but they just couldn't afford it. And that experience made me want to dig deeper and really pick this topic to figure out why. And in my research, I used data from the Kaiser Family Foundation, the Commonwealth Fund, and NPR. And the fact is clear, the cost of care is hurting people financially, physically, and emotionally. And I have this graph here to show how much it has gone up since 2022. As you can see, before COVID, it was at its high of 10%, and then it's dropped down in 2022, and then it now is starting to rise again, of people not wanting to go get healthcare affordability or healthcare because of the affordability. So, as you can see from this chart from the Peterson KFF Health System Tracker, the number of Americans skipping care due to cost has came back up since 2022, and it affects all kinds of care, including medical, mental health, and prescriptions. So today, I want to persuade you that healthcare affordability is a national crisis that demands urgent policy reform. And first, I will explain how high costs are harming everyday people. Then I'll show how smart policies can protect patients from and make care more accessible. Let's begin with the problem. The cost of healthcare leads people to delay or skip treatment, putting their health at a higher risk. So, according to a 2023 report from the Kaiser Family Foundation, nearly 50% of U.S. adults say it's difficult to afford healthcare. 1 in 4 say they or a family member have skipped necessary care because of the cost. Now that is a high percentage. And I also have a visual aid to show that, as you can see, 64% are the uninsured, and the rest you can see it's a little bit lower for people that have insurance like Medicare and Medicaid, but that is still a very high percentage. And from the bar chart from the Commonwealth Fund, it shows clearly the most impacted people are the people that are uninsured, with again 64% adults reporting delaying care and prescriptions in the past year. So, what happens when care is delayed? Chronic conditions like diabetes, cancer, heart disease, they just get worse. ER visits go up, lives are lost, and for those who do get treatment, the financial strain is brutal. The Commonwealth Fund notes that in many households, healthcare cost takes up so much of the monthly budget that families must sacrifice things like rent, groceries, transportations, just to stay afloat. So healthcare affordability isn't just a health issue, it's a daily survival issue. So let's talk about the solutions. We need policy changes that stop aggressive debt collections, reduce out-of-pocket costs, and make care affordable from low-income patients. Republican State Senator Steve Neville supported the bill and said, There's not much advantage in trying to collect from people who don't have money. If they don't have it, they don't have it. And he's right. Punishing people for being sick and broke isn't just cruel, it's useless. You're not gaining anything from that. We need nationwide policies that mirror that kind of common sense. That includes expanding Medicaid in every state, setting national caps on out-of-pocket cost, and requiring hospitals to clearly disclose prices for and offer financial assistance. And I have this other visual aid right here. Share of adults who have medical debt by state through 2019 to 2021. And you can see South Carolina right there with an 11 to 14%. So this map right here from KFF shows that states with stronger patient protections tend to have lower levels of medical debt. And these reforms work, and they can work nationwide. Clearly, South Carolina needs to. Now, I get it. Some people argue that expanding government programs will raise taxes or create more bureaucracy. But research from the Commonwealth Fund shows the opposite. When people avoid care, it ends up costing more through emergency visits, untreated illnesses, and economic loss. Investing in affordable health care can save lives now and money later. So why does this matter to you? Because no one should have to choose between paying rent and staying alive. Healthcare in America isn't just a personal issue, it's a public problem that demands action. So let's stop punishing people for getting sick. Let's support reforms that reduce debt, increase access, and put patients first. A healthier, fairer future is possible, but we have to fight for it together. Thank you.